Hi, welcome to Real Nurse Stories. Today I'm really thrilled to welcome Amanda to the podcast episode. Amanda is working currently as a community specialist practitioner, and she's a team manager in the Tameside Glossip area, which is in the northwest of England. Welcome to the show, Amanda. It's lovely to have you here.
Thank you.
So, Amanda, I've had a little look at the information you've sent me, and you've got a really interesting career, really, from where you started and all the things that you've done in between. So I'm going to start by asking you just to share, really, your journey and where that journey into nursing started.
Right from the beginning, I was told at school that I wasn't clever enough to be a nurse, and I believed that right from the beginning. So I took every job that I could that wasn't nursing. But at the age of 21, I found a job in a nursing care home. I work in all different shifts, and I absolutely loved it. I loved working with the nurses and sharing their skills and knowledge, walking around assisting them. But then I had a young family, so I left, and the best job then was like a community works, home and community support. So I sort of did that for quite some time. Still believed that I wasn't clever enough to go on and do my nursing. And a secondment came up for a rehab support worker, so I applied, and I thought, a different challenge. And when I got in there were all these assistant practitioners and trainee assistant practitioners around, and it just sort of sparked a bit of an interest, because when they were explaining how they got into their career, I thought, that's something I could do, because obviously it was a work, earn and learn programme. I had children, so I couldn't afford to leave and do my nursing like you had to then. So that I applied for it. I wasn't successful the first time. And I was told I interviewed really well, but obviously somebody picked me to the post. Bit of a confidence knocker, but then the morning after, they phoned me back and said, "We've got another opening and you were the next in line. Would you like to take the job?" So I did. I said, absolutely, I took the job. But so I started at Bolton, but I have a nervous laugh, and that's put me off for quite some time as well. So I was sort of quite apprehensive about taking on the course, because I knew that I'd have to do presentations and stand up in front of my peers and other colleagues. But I thought, if I don't do this now, I never ever will. So that's where I started. Managed to complete the course with some brilliant support and some guy, because obviously they knew the issue. It wasn't sort of a little bit of a giggle. It was quite a debilitating, hysterical laugh when it happened. So they worked really well with me. So when I came to the end of that, I thought, absolutely, oh my God, look what I've achieved.
Yeah.
Got a job back in this, because I did my placement in district nursing, and I adored district nursing. So I got my job back in district nursing as an assistant practitioner. Then you watch people and think, I could do that. I could do that job. And then I'd hear people saying, "Oh, you can't do that because you're just an assistant practitioner," and it sort of sparked a bit of I can't think of the word, like a bit of a hunger. And I thought, actually, I can do that, and I am going to do. So I sort of started looking into how I could then go on and do my nursing, and with the support of my trust. But regardless of whether I got the support of my trust, I was going to leave anyway, because I thought, no, I need to do this now. I've proven to myself I can do a degree level course, so why not? So I applied at Manchester Met and got a place on my nursing. And I just spoke to she's our practice education facilitator with the CSPs now. And I remember sitting with her and saying, I'd love to be supported by the trust, because when you're a TAP, they tell you that they're going to convert you and you'll get on the register and you'll get this, that and the other, and nothing ever happened. So she went, come on, let's send some emails. Let's send some emails out. So I emailed everybody I could, everybody and his dog, to see if I could get a secondment. And I did. I was constantly, but I kept it really secret, really sad, really. But I didn't want to fight with other people, because I knew my debilitating laugh would have sort of had an impact on any interviews if I was going up against anybody else. I still didn't have that confidence to think that I had what it took. So I just kept emailing, and luckily I secured a secondment. I was told I was very tenacious when I went and signed the paperwork. So and I sort of thought, I said, "Do you mean Gobby?" And she went, "Absolutely not." She said, "You've seen something that you really, really want, and you've not stopped till you've got it, and you should be really proud." So then, obviously, I went to do my nursing at Manchester Met and did all my placements. So I'd gone really from being an experienced assistant practitioner with lots of skills and knowledge to sort of going back to basics and trying to forget what I knew, because obviously I knew I had to learn. Being a staff nurse was different. So I did that 3-year degree. And as I was coming to the end, everybody kept saying, "Oh, you need some ward experience, you need some ward experience," because I'd never worked on a ward. So I did 6 months on a ward, definitely wasn't for me. So I went back to community as a staff nurse, and I absolutely adored my job. I loved working. I'd worked in every single team where I work in the borough that I work for, and just watching all the nurses that I work with and all the sisters. Then I was it didn't the aspiration didn't stop. Then I sat there thinking, God, I could do that. I could do that. And so that's what I started looking at my peers, the sisters in my team, and saying, "Can I work with you? Can I do some work with you? Can I come out on your visits to see what the difference is between a community staff nurse and a community sister?" Because we can all say, can't we, "Oh, I could do her job. What she do?" Say all, and we're all guilty of saying that.
Yeah.
And actually, when I started working with all the team managers and the team leaders within the team, it was like, wow, this is another ball game, and I want to do this. So I then started working with them to get my experience, so I could apply for the CSP course. And again, I wasn't successful the first time. Absolutely devastated, because I'm thinking, they don't think I'm good enough. It's one of them, they don't think I'm good enough. I'm going to leave. So I left for 3 days and went to work at the Christie's. Just wasn't for me. So then I came back to community, and just thought, no, this is where you need to be. Stick at it and just start working towards reapplying. So the year after, I reapplied again and was successful in getting on the course. It's really difficult, the course, really full on, but actually I loved it. I loved all the doing the assignments, doing the presentations. Even though I'd gone from being an absolutely terrified presenter, I'd got better through time. Worked in a team to do my course, and then as I qualified, we had to apply for our jobs. So I applied back to district nursing and back into the teams that I'd worked in, and was successful in securing a sister's post in the team that I'm in now. So I'm 8 months in now, and I feel like especially through this time as well, that I've really found my feet and feel that I've really progressed within the role since I've started. So that's where I am.
It's a fabulous journey, that, because to have those aspirations, and listening to you talk about that, you've had some challenges in there, you've had some knockbacks, you've been open about your debilitating laugh and how that affected you, and you've overcome all of those things to actually achieve a goal that is something that you've really, really wanted to achieve.
Somebody that told me, achieving a goal that somebody told me, actually, you'll never do that. You're not clever enough. And then through the times when I'd not got on, it was almost like I took a bit of a knock, and I'd sit there and have a sulk and think, oh, I'm not good enough. And then I think, actually, no, I'm not stopping here. This isn't the end. But I think there was a lot of, I have had negative feedback, because obviously when I did my TAPS training, I have obviously got negative feedback about, you get a lot of negative comments, like I said before, well, you can't do that, you're just an app, or you can't do that, you're not registered, or I'm not going to do that with you because you're not a registered nurse. And I just think I wanted to go that extra mile and be where I am, so that, because I've got a really good understanding of every single role as well. So I use that in my role now with the assistant practitioners that we've got. and we've got registered nurse associates now, to, you know, to really value value them and nurture them as well. If that makes
It
sense.
does.
Yeah.
It makes
Yeah.
perfect sense. And I think, you know, you must be a real role model for the trainee assistant practitioners that work with you, you know, hearing your story and looking at where you've come from and what you're doing now. That to them must be something that, you know, they in turn can aspire to. So you're influencing almost the next generation, aren't you, in that sense?
Yeah, and when because I wrote the article with Trish, and I let people read that, because some people didn't quite know my story. They just saw that I'd gone from each role, but they didn't know why. They didn't know what aspired me to take them steps, and the challenges that I've had along the way. Because obviously I've had financial, I've had young children, I've had a very acutely unwell son throughout that as well. But it was nice the response I got when they read, actually, oh my God, I want to do what you've done. And I've had like really candid conversations with quite a few of the apps and tried to prompt them into going further. But, you know, and saying, if you ever you want to look into it, I'm with you, we'll do it together, we'll look at all the ways you can progress. So, and I've got a few that are sort of looking at because they're doing a new apprentice model that they're going to be considering converting and doing what as I've done. Yeah.
Do you think when people said to you at those various points, you know, you can't do that because you're only, you know, assistant practitioner, or do you think that made you more determined? Was that like the...
Absolutely, because you think, well, actually, yeah, I can do that, and I would be able. It's just that I haven't got the qualification that you have, but show me and I'll do it. But I knew then, well, the only way I'm going to show people I can do that is go and get that qualification.
Because
So
I guess for some people that could go either way, couldn't it? It could be, you know, some people might hear that and think, oh, you know, no, almost agree with it. You know, somebody's told them they can't do it, so they can't. But for you, it's had the opposite effect of, you know, almost, well, I'll show you because I am going to do it.
Absolutely. And I would never, ever say anything like that to any of the teams that never, because you think, well, actually, they probably could. And, you know, we've got some really skilled assistant practitioners and registered nurse associates in our trust and our teams. They're amazing. And, you know, we need to nurture that and let them know that they're amazing and they can do anything they want to do.
Yeah. And I think it's really interesting because community nursing, you know, it still can be viewed as it's not the sexy nursing, for want of a better word. You know, I talk to students and I always ask them, you know, it doesn't matter where in the world you ask this question, you always generally get the same response, and it's either ED, ICU, you know, all the high tech areas, and it's quite an interesting response, I think, is the way that I would put it, when you say to somebody that that's what you want to do. And you know, I just wonder how you dealt with that, because you really went straight into community nursing from qualifying, didn't you? And how did you manage that with your colleagues?
So when I qualified, I did 6 months because I'd done all my placements, and I qualified and went 6 months on a respiratory ward. I did 3 months and then handed my notice in because I knew that I wanted to go back to community. And I remember one of the ward managers turning around and saying, "Oh, aren't you worried you're going to get de-skilled?" And I just looked at her and I went, "De-skilled? Where on earth do you get that from?" I said, "Because while I'm on this ward, all I ever do is push a drug trolley around, follow the doctor, put IVs up." I said, "But when I'm in community," and I started rolling off the things I did, and she was a bit like gobsmacked. And she went, "Oh, I didn't know you did all that." And that's it. People don't know. They think we're going to sit in somebody's house and have a cup of tea, do one leg. But actually, we do so much in community. We do so much in community. And more things that used to be done in a hospital are now coming out to community. We're picking that up, you know, and we don't have a 32-bed limit and that's it. We're closed. We're just taking it. We want to keep people at home. My daughter is in a 3rd year of adult nursing, and she told somebody that communities where she wanted to go.
Ah.
She's done some placements and everything, and she got the same response. Well, you'll be de-skilled. And my daughter similarly did the same thing as me. Do you actually know what a district nurse does? Do you actually know what they do in community nursing? And they sort of just shrugged their shoulders. And when she told them, it was the same response. Oh, didn't know they did all that, because we don't shout it from the rooftops all the time, which we should. We should. Yeah.
So I wanted to ask you, because people listening might not realise the differences, to a layperson if they've not experienced district nursing. So can you just explain for me what the difference is between being a ward nurse and a community or a district nurse?
Oh, the difference.
It's your opportunity now, Amanda.
Yeah, there is. I mean, the aim of a community or a district nurse is to keep people at home safe and well. So, I mean, we do have IV teams within district that sit in community, but district nurses don't do that. But we do sort of lots of end of life care, lots of acutely unwell patients that want to remain at home. We will monitor and support them to remain at home. I'm trying to think what we do now. We manage with lots of diabetic patients, catheter care, to stop them from being admitted into hospital with catheter problems. We monitor and manage them, or wound care, post-operative care. We do lots of CHC screens to keep people safe at home, to make sure that they've got the appropriate care to maintain safety there. Oh, I'm trying to think. It's hard to think on your feet what you do in a day. Patients that are having chemotherapy treatment, any cancer treatments, we monitor and support them. And if they're having chemo brought home via a pump, we go and remove the pumps and make sure that they're safe and well, monitor them along their journey. I'm thinking of anything else I can think of.
It's a different emphasis as well, though, isn't it? Because as you know, I used to also work as a community nurse, and I think for me, it was always a real privilege to be in someone's home, because you are literally invited into someone's home, as opposed to when you're working in a hospital, the patient's in a ward, in a bed. It's a very controlled environment, whereas the home is different.
Oh, so much so. I think you see the patients in their own environment. They're more relaxed. They're more, and it's like you said, you're a guest in their home, it's sort of a privilege, because you become part of their family, especially if we have long-term patients, their family network. But you see them you almost see the difference of, you go into hospital, you put your pajamas on and you get in bed.
Yeah.
Or you sat at the side of your bed, and we see them in a more relaxed environment. They're very vulnerable. I mean, they're vulnerable at home. I'm not saying they're not. They're more vulnerable in a hospital environment because they've not got their own surroundings. Whereas when we go into their home, they're dressed, they're walking around their own little environment. That's their space, and they feel comfortable in that. And it's almost like they're in control, and you're going in into their space. And it's about having that sort of appreciation, that they're welcoming you into their home, and that's humbling sometimes. It really is humbling sometimes.
And I can also remember one of the biggest issues we often had was, and I'm sure this is probably still the same when you visit people at home sometimes, and the home environment is, let's just say, not how perhaps we would want it to be as individuals, but again, you have to accept that, because that's their home and that's how they choose to live. So
and that's right for them.
Exactly.
That is, and you think you just have to. I mean, there's been something very, very similar quite recently, where a comment was made, and you have to say to them, it might not be how we are or we live or what we think is right, but that's right for them. And if that keeps them safe, and if it keeps them at home, and they can manage and be independent, then that's right for them. And who are we to judge that? Because we're not, because they might come in our home and think, well, this isn't how I do it, or this isn't how but that's it's right for me. So you just have to be sort of quite open-minded when you go into some places, but you have to also remember that that's their home and that's their safe space. So.
And you meet some characters as well, don't you? I can remember that.
Yeah, definitely. Some brilliant characters, and that's the beauty, I think, when they're at home, their character comes out more because they feel safe. But some great sort of, you're not, because you become part of their family. You get to know like little quirks and their personalities really shine through. And when you're come, it's like they look forward to seeing you, so that you can have them little bits of banter with you and chats with you and offload, because I might be the only person they see as well. So and I think that's the beauty of going to somebody's home as well, that once you're behind their closed doors, it's just you and them, and there's no rush. You haven't got a doctor outside the curtain that wants you for the next bed, or somebody shouting because they need your help for something else. It wants you're theirs, and it's their undivided attention in their home, and I like that as well. You don't answer your phone, you leave your phone off. If somebody's ringing, you ring them back when you come out of the call, because that time when you're their home is for them. And it doesn't matter if it takes 15 minutes or an hour. You've got to give them that time.
And I always used to think it was a bit like being a detective, that you've got that time, but you're also on a fact-finding mission to piece all the bits together, Yeah.
And sometimes you don't know what you're going to walk into. You think it's just going to be a like, you'll get a 15-minute slot and it'll just say 10 to wound, and you walk in and it's like, is it a 10 to wound, or is it everything else that you found while you're on that visit, and you're actually there for an hour and a half? And I think as a community specialist, that's sort of our role, to unpick lots of things. So our visits tend to be a little bit longer, because if the staff nurse is going, they'll pick up on them things and bring it back, and then we support them to do what they're doing. But your visits, you never know. Do 1 minute, you could go into that house and it'd be 15 minutes yesterday, and you go in the next week and there's a whole can of worms that's been opened up, that you find all sorts going on, and that needs managing while you're there. So,
and also your training as a community specialist practitioner, kind of that training encourages you to think broadly, doesn't it, about the community where you work, and understand things like the networks and the services, and not just like the social care services, but voluntary services. So a huge part of that
prompts you, doesn't it, to think outside the box and look at other ways, but also think outside the box when you're inside the patient's property as well. Don't go in tunnel vision, just doing the job that you're there to do. It's about looking at everything, and you tend to walk in and it might be a leg wound, but you're sort of looking at every single thing that you can see while you're in the property, and you're having them conversations without them knowing, prompting little questions that are just they think you're just having a lovely conversation with them, but out of them things you're getting all the answers that you need to make sure that you're doing.
Have to be really a skilled communicator. I think you've hit the nail on the head. People don't realise it. To them it's just like banter and having a chat, but actually you are collecting information by the conversation you're having.
I remember going to somebody once and had this conversation, and it was hilarious. The conversation we'd had was hilarious, and I think vodka was involved, that she'd mentioned something about vodka. But out of that full conversation that we had, I got how her mood was, that she was eating and drinking, that she was out and about doing things that she wanted to be doing, she was communicating well. I got loads out of that conversation, and she thought she was just having a little bit of a giggle and and letting me know how a weekend had been. But it was brilliant because you got so much out of that conversation.
Yeah.
You know,
Yeah.
it's mad, but it's about thinking outside the box.
What's the best part of being a community nurse, Amanda? Because you're passionate, your passion comes across really, really strongly when you talk about it. So what's the best part for you?
Oh, all of it. I love it. I just think that for me, the privilege of being welcomed into somebody's home and being welcomed as part of their little network. And I think you can't get anything better than that. I think when you walk in and especially, I mean, mine's end of life care. I love end of life care, and it's when you walk in and it's that relief that you see on the face when they see your face and they know it's you, and then you've got them that good sort of bond with them to be able to provide everything that they need, and they know that when you're walking away that everything you've said you're going to do is going to be done. Yeah, but I think all of it, I just love it. I don't think I could. I know it sounds awful, that doesn't it?
No, it doesn't.
I mean,
it doesn't.
I couldn't do any. I just love district nursing, and I would be an advocate for district nursing any day of the week.
Yeah.
And I'm not saying. I mean, I've worked in wards. I had a great time. Met some brilliant people. I have lots of friends that work on wards, but for me, community is just the best.
Yeah.
The best.
Yeah.
Yeah.
And also
getting welcomed. Yeah, getting welcomed into people's homes and just being part of their little network is perfect.
And I think the other thing that a lot of people don't realise as well is there's a big preventative side of the work too that district nurses do. So, you know, some of the things you talked about, the caring for people, end of life care and the post-operative visits, but there's also a lot of preventative work in collaboration with GPs that goes on as well, isn't there?
Yeah. I mean, we're part of an integrated team now. So in our base, we have, and in all the bases around in Tameside and Glossip, we have social workers, social prescribers, OTs. They're all sat in our office. So it's great because you can have an encounter a problem in the visit, and you just go back to the office and you just look round and you'll say a name and they'll go, I know that person, and then you can make sure that everything's done there and then, you know, or try to get everything done there and then. But a lot of, you know, preventing admissions, preventing sort of people being socially isolated as well. That's the big one, because if we see that, we've got people in our office that we can tap into and find ways of making that not happen.
It's a fabulous role, you know, and I can totally relate to. It brings back all kinds of memories as we're talking. It is. I think once you've been a community nurse, it's almost like it's in your blood. It stays with you wherever you go. You've still got those, you know, memories. I have anyway of my time.
Yeah. I mean, we've just had, obviously, with all this COVID-19 going on, we've just had some redeployed staff. Brilliant. So we've just had an advanced nurse practitioner, we've had somebody from CHC, we've had somebody from health visiting, and they've come into district nursing and sort of, especially now, I know in most teams, but especially the ones that we've worked with because we know them, they've loved every minute of it. And at first you saw sort of like a bit of anticipation of that it's going to be such a challenge, but actually they rose to that challenge. And two of them, when they got told they were going back to their own role, quite sad. And so they've sort of said, as an advanced nurse practitioner in the extensives team, she's going to come and base herself a couple of times a week in our team, so we can work well together there as well. So that's for your, you know, like your COPD or anybody with a long-term condition. And we have loads of them people on our books that we look after. So what better way than to sit and work together?
Absolutely. So tell me a little bit, because you referenced there about COVID-19. How has that been as a challenge for community nursing?
But it's trying to get the words right now. It's definitely been a different way of working. Because some of our visits that we would normally routinely do, we've had to stop. and then obviously you've had to let the patients know why we're stopping it. So we've stopped simple visits, and we've encouraged the GPs to prescribe other medications and like the B12s, other ways of administering it to sort of to lessen the footfall into patients' homes. If we've normally been seeing people a couple of times a week, we've tried our best to make sure that they're being seen maybe once a week. But also the patients, when we're going in, a lot of them are on the ceiling because this is so uncertain for them. So we're walking in and we have to be like, oh yes, everything's all fine, and you know we're trying to make sure that it's with minimal disruption to them. But I mean, we're sort of going out with less visits, but then less visits are sort of more challenging. We've obviously, if we've got somebody that's COVID positive, we have one special nurse that they see COVID patients only and nobody else. But we're doing sort of the PPE the same. We're wearing masks, gloves. Just a different way of working. I think it's harder when you're doing the end of life care. Because your first instinct, if you're looking after somebody, is to sort of console the family. If they're sad or upset, and we can't do any of that, it's sort of like you sat on your hands, because the first thing you want to do when somebody's loved one's passed away is hug them and tell them how sorry you are. And it's sort of that's a no, and it's difficult. It's difficult. It's just a different way of working, I think, at the moment.
And I can see how that could be really difficult, because it especially end of life care, it is very you get those close relationships, don't you, that form with the patient's family, and a lot of that is, you know, like you would give somebody a hug, and you can't do that anymore because of COVID and the no contact. And I can.
You're going up to them with a mask, a mask on your face, and there's been quite a few where we've gone in and you're smiling at your patient. They can't see that because you've got a mask over your face, or they're relying on a bit of lip reading because they can't hear what you're saying, or your facial expressions for the patient that's end of life or poorly in bed, or the patient that you go and see to do anything. You've got a mask on, they can't see, and that must be really scary for them. I find myself saying, I'm smiling at you under this mask, because I'm quite a smiley person. Or you'll have people going, I can't hear what you're saying because I normally lip read. So it's things. There's lots of different challenges coming with this as well as just the COVID-19. How we're nursing, it's just a little bit different. But we're coping well, I think. I think we're coping well. Yeah.
Can I just go back for a moment, Amanda, I just wanted to ask you a little bit more about how you overcame some of the challenges around presentations, because I know that, you know, that requirement, certainly from the training you've done and in your current role, you know, presentations are something that are part and parcel of your work. And I'm just interested to know how you overcame that, you know, for the benefit of perhaps someone listening who's maybe had a similar experience or who has a fear of presentations. How did you tackle that on a personal level?
So, because people used to ask me how, because of the nervous laugh that I have, how do you manage in your day-to-day work? But because I'm quite confident in the job that I do, it doesn't affect me in sort of my day-to-day work. It's almost as if I'm talking to you now about what my role, and I'm quite comfortable. It's just like a little bit of a chat. But if you sat me in front of 25 people and said, now tell these about it, I'd buckle, and I know I would. But I think I still do it. I still laugh a little. The last one I did, won the community specialist practitioner with presentation in there. I still did, but I think it's that ensuring that everybody knows about it before. So the lecturer that I actually went to speak to her first and said, this is my issue. I work through it. I will do the presentation. but there may be some sort of little bit of a blip, and it's almost like they're constantly saying it doesn't matter. It doesn't
No.
matter as long as you say what you need to say.
Yeah.
And I don't know. I've just thought it still happens, but I have to try and not let it affect the fact that I do know what I'm talking
Yeah.
about. Does that
Yeah.
make sense?
Yeah,
I don't
it does.
I don't think I've ever overcome it. I think I've just learned to work around it.
Yeah. Yeah.
I think that's because when I did my adult nursing, I did the presentations there, and it was the same. I
Yeah.
think one of the presentations I only did it in front of 2 lecturers because they knew that it was a massive anxiety. And then and I found other ways of doing it because I used Prezi.com as well to do one of my presentations, and I recorded my voice,
Yes.
and I submitted that, and I think I got about 78%. It might have been a bit more, about 78% in my mark. So yeah, I don't know whether I've overcome it. I've just found ways of dealing with it.
Yeah.
I
You're
sort of, yeah,
being
don't let it.
creative.
Yeah, don't. I might laugh while I'm doing a presentation, but as long as you can hear what I'm trying to say, and as long as I
Yeah.
can get my point across, I think I've done a good job. I
Yeah.
mean, I remember sitting down after I'd done my last presentation and somebody turning around to me and saying, God, you know your stuff, don't you? And that was all she took. There was nothing about, oh my God, you laughed all the way through that, didn't you? It was
Yeah.
almost as if they didn't see that. They just said to me, God, you certainly know your stuff, don't you?
Yeah.
And it's like, yeah, I do. So I think that's it. Don't let that define you.
No.
I
And
think.
sometimes those fears are in our head, aren't they? That we think the worst of something, and then
Yeah,
when you get feedback like that, and they what they heard was how experienced and knowledgeable you were in your presentation, and didn't hear the bit that you feared they would hear. So
yeah, yeah.
yeah, yeah,
And I think that's been each time. I remember doing my very first one. I did it about honey, and that was the same. I remember because I told them I have this. I laughed in the interview when I went for my trainee assistant practitioner role. I laughed all the way through my interview. How I got that job, I'll never know. I didn't, but obviously, what I was telling them after I'd settled down was
yeah,
the right thing. But each time I've done it, I think it's in my head because
yeah,
not one of them have ever said, well, that was awful. You laughed all the way through it. The response has always been the same. You know your stuff.
yeah,
You've looked into that and you know what
yeah,
you're talking about.
yeah.
So I think, yeah, don't let that define you. It's
No.
all in your head, that, I think.
And the fact that you're upfront about it and you've said
Mm,
that to people first, I think says a lot about you and, your determination to
yeah,
succeed in things. You're saying, this is me, this is the issue I have, and being upfront with that rather than
yeah.
perhaps the opposite of that is not saying anything and trying to hide from it, which,
See, I tried hypnosis. I went to somebody, I tried hypnosis, and it didn't work. And I think it's anxiety is a good thing because it challenges you. I think sometimes that anxiety, it
yeah,
challenges you because you think after what an accomplishment with all what was going on in my head, and I still managed to do that presentation and
yeah,
get quite a good mark. So yeah, I think, don't. This is me. This is who I am. And I'm a good person. I'm a good nurse.
yeah,
So you can't let that
no.
overshadow how well you can do in your job,
No.
I think.
And really, when we go right back to the beginning, when you were first thinking about nursing, the person that said to you, you weren't clever enough to be a nurse in some ways has been a motivating factor, hasn't it,
I
in
wish
your
I
career?
I wish I could see them now. I mean, I don't even know how old they'd be now because I was, what was I said, 15. I'm 50 next, and I think I'd love to see you now.
Yeah,
So would they
yeah,
be then? Maybe they'd be about 70. So
yeah,
maybe one day I might come across that person and they might
yeah.
remember me and think, oh, no. But yeah, don't ever. And I think the biggest thing is don't let anybody tell you you can't,
No, no,
because I
absolutely.
think with hard work and determination and being passionate, you can do anything.
Yeah,
You can do
yeah.
anything.
You can, and
So
you're a
yeah,
testament to that, Amanda, very much so.
yeah. And now I've got sort of my like I said, my daughter's in the third year now, and I say the same to her. Don't ever let anybody tell you that you can't do it, because you can do anything you want to.
Yeah.
And then my sister now is sort of going to follow a very similar pathway to me, I think, because she's just secured a place on the registered nurse, the trainee registered nurse.
Yeah.
I can't even say it. The trainee registered nurse associate course. So very similar. She'll start as a band 4, and I'm hoping that she'll see what I've done
Yeah.
and think, yeah, I can do that
Yeah.
as well.
Yeah.
Why not?
Yeah, you're
Why not?
certainly an inspiration to,
Yeah,
I think, anybody listening to this, and also the people that you work with, you know, seeing and hearing what you've gone through to get to where you are is really inspirational.
yeah.
Let's just think about one of the things that you said, and the information that you sent back to me about. It made me chuckle when I read this, so I'm going to ask you to explain a bit more. One of the things that you said you do is that you sing a lot because it helps you to keep calm, and that's one of your personal habits that you feel contributes to your resilience. Tell me a bit more about that.
I am known as the singing nurse. When I qualified as a staff nurse, I looked after a gentleman on the ward, and I was asking him he wanted to go home and his medication weren't ready. I said, "Where do you live? Can we not send it to you?" And he said to me, he told me his address, and I'm thinking, I know that address. Where do I know that address from? And he lived on the same street as my dad. He was my dad's next door neighbour. And he went home, and he said to me, he collared my dad, and he said, "I've just had the most loveliest nurse look after me." And my dad's going, "Oh, did you? That's really nice." And he went, "Yeah." She was like the singing nurse. She was an angel. "Do you want me to tell you who she was?" And he went, "Can do if you want." He went, "That was your daughter." And
Oh.
that was where I was named the singing nurse. And I don't know. I think I do it now all the time, and I can't sing, but I don't care. I sing all the time because it just makes me feel happy and makes people
Yeah.
laugh.
And
So I
is
just
that something that you do kind of regularly? Is it a daily thing? Is it a daily practice that you do, or?
I sing all the time,
Yeah.
literally. And I'll go into somebody's house, and I think I'm good at reading a situation, and I
Yeah.
might go into somewhere and I'll say, I'll say, "What songs do you like? What music do you like?" And I'll put it on my phone while we're doing bilateral legs, and we'll sing. I'll go in the office and a song will come on the radio and I'll start singing it, or I'll sit there and I'll look at everybody and I'll say, "Oh, I've got this song stuck in my head, so we'll have to sing it now." So then I just sing in the office. But yeah, if there's a lady in our office and she works for the social workers and she wears red a lot, so I walk in singing to her quite often. But yeah, just if you're in a bad mood, just sing, makes you feel better.
That's so true. So
Yeah,
true.
yeah.
So knowing what you know now, Amanda,
Mm.
what advice would you give to somebody just starting out, maybe with an aspiration to become a nurse, or somebody in a similar situation to yourself who's maybe working as an assistant in nursing? What would you go back and say to them?
Just don't stop, and don't let anybody tell you can't, because there's always a way around it. And I think just be determined and just be confident in your own abilities. And I think some people, me personally, I wasn't. And I think sometimes now it still comes out a little bit that where I'll say, especially to my manager, am I still all right? Am I still doing a good job?
Yeah.
And I think because you don't want to become complacent, and I just think don't stop. If you think you want to do something, just have a go and find anybody you can to support you in your
Mm.
journey.
Mm.
Yeah, definitely. And unlike now with my team, I said the same thing. I try to be a good mentor, because I think I've had some brilliant mentors along the way, and without them, I probably wouldn't be where I am.
Mm.
There's one that's been in my journey from day one. I went out with her as my first day as a trainee assistant practitioner, and then I qualified with her as my manager as a community specialist practitioner. So she's been my 13-year journey, and there's been a so she was the senior staff nurse when I worked with the first district nursing team, and then when I went to do my community specialist practitioner, she was the practice educator. So she's been there, but there's been loads that I've looked at and thought, yes, I'm going to be just like you.
Yeah.
So I think just find a good mentor.
How did the mentorship help you?
The mentorship course?
No, the mentorship that you've had from the lady who's been on your 13-year journey.
She kept me grounded.
Yeah.
I think she kept me very well grounded, and I think so she was the one that helped push me when I was doing my nursing. She was the one who helped these are the ones you're going to email. Let's email these. Because somebody said to I said, I'm going to try and get us a comment, and she was one of the ladies said, it won't happen. And I thought, right. So this is the lady. Yeah. She's called Andrea, and I just said to Andrea, can I just have a chat? And I told her, and she went, rubbish. Come here, and we got the email up, and it's that she's pushed me when I needed pushing, but she's also grounded me when I've needed grounding. And like when I didn't get on the course the first time, we sat together and she went through everything, and she said, this is where you need work. Go and work on that, and then come back and reapply. So I did. I worked on everything she told me, and when I come back, she could tell that I'd gone away and worked on everything that she'd told me to work on. But yeah, just she's pushed me when I've needed it and grounded me when I've not, when I've tried to run before I can walk. So yeah. But she's been a very good influence, as have a lot of the nurses that I've worked with.
Yeah,
people that have said, when I've said this is what I want, they've gone, right, well, come on, let's come and work with me. And we'll do some of my work with me. So yeah, it's a good thing. Be a good mentor. That's another thing. If you're going to go anywhere along your journey, be a good mentor, because if you're a good mentor, then the people you mentor will be good mentors also.
Absolutely, that's good advice.
Yeah.
Final question.
Okay.
How would you most like to be remembered in your career?
Don't make me cry. that I never gave up, and that I aspired to be a good nurse, and that I've what's the word? That other people have looked at me and thought, yeah, a role model, a good role model. Yeah, that I've been a good role model, and people have sort of took bits of my little bits of advice and used them and progressed in their careers the same. I think. Yeah.
I don't think there's anything about it.
I think the biggest one is that I genuinely do care, and I absolutely adore my job, and I just think it's the best job ever. So,
I think anybody listening to this episode, Amanda, will be left with no doubt at all about the legacy that you leave, because it comes through loud and clear. Your passion for what you do, your passion for inspiring other people to do what you've done, and don't ever stop championing community nursing, because you're such an advocate for it, and it's so wonderful to hear that.
I think the best thing as well, I think our graduation for the community specialist practitioner may not go ahead this year, and which means I'll graduate with my daughter next year.
Oh, how lovely. That'll be lovely, won't it?
Fingers crossed, yeah. So that'll be my legacy as I watch her graduate, I think. Yeah. And then the year after, watch my sister graduate as an RNA.
Well, that's a fabulous legacy, isn't it, really, for your family, seeing what you've done. You've inspired them to do the same. So, the ripple effect from all your grit and determination, and, that's just fantastic. It really is. And thank you so much for sharing your story and your journey, because I've thoroughly enjoyed talking with you,
Oh,
because
thank
I
you.
just think, you know, community nursing is, I always considered it to be a privilege to be a community nurse, and I think you're just such an advocate for that, and we need more nurses to come in and work in community nursing. And
Definitely.
you know,
Definitely, give it a shot.
yeah,
It's a good place to be, and I
yeah,
think we need to get rid of the misconception that you can't go straight into district
yeah,
nursing, because
absolutely,
we want that now. We want people in community, because it's the way forward.
yeah,
You know, and a
yeah,
lot of things that are being done in hospitals, or were being done in hospital,
yeah,
are now being done at home. So we do need to shout from the rooftops about district nursing.
yeah, yeah,
It's we're out there. I think sometimes we just get forgotten about,
yeah,
but we are out there, and it's a brilliant place to
yeah,
be. Yeah,
absolutely.
yeah.
Well, thank you. It's been
You're
lovely
welcome.
to interview you.
Thank you. Thank you.